My name's Dr Anna McNulty. I'm the Director of Sydney Sexual Health Centre. I'm the Chair of the committee to assess those who knowingly expose others to the risk of HIV infection. And that's a committee that meets every 4 months or on an as-needs basis and assesses notifications. So those notifications can come from members of the public, from healthcare workers, from public health units, from doctors, nurses, partners. They can be anonymous or named, and we assess those and make a decision as to what needs to be done beyond what has already been done, because often there's a management plan in place, and so decisions are made as to whether that should be scaled up and whether we need to keep a watching brief on that person or whether there's no further action needed. And so some people who are generally the more complex individuals with HIV, so people who have mental health problems or drug and alcohol problems, they're homeless or a range of other issues, they're the ones who we usually follow more closely and put in place a sort of case management framework that's managed by the local health district, but we just receive reports for it on an ongoing basis until we're happy that the person is no longer putting others at risk. So that's a statewide service, and that's governed by a policy directive that was released by the Ministry of Health. The management of those who knowingly expose others to the risk of HIV infection is a graduated response. So the first step is usually around counselling the person about their obligations under the Public Health Act and supporting them in meeting those obligations. And where they would struggle to do that, then often where other external factors are impacting on their ability to have protected sex or to disclose to others, then the more intensive approach is adopted. And if those measures fail, then people can be sent a letter of warning which outlines their obligations and may direct them to participate in certain activities, such as to attend certain clinics or to take antiretroviral medication. And very rarely a public health order can be issued, which again can have various provisions around prescribing what the person has to do or needs to do.